Good afternoon, my name is Perez, and today I'm going to be talking about rotator cuff tear. So some of the main points I'm going to try to hit with you guys is what a rotator cuff is, two of the main causes of rotator cuff tears, the types of rotator cuff surgery, the recovery and rehabilitation process, and some of the post-op exercises. So before we begin, are you guys familiar with the rotator cuff?
No.
No?
Not very much.
Okay, so for people who don't know what a rotator cuff is, rotator cuff is a group of muscles and tendons that surround the shoulder joint, keeping the head of your upper arm bone firmly within the shallow socket of your shoulder. If you'd like to zoom in, please, this is a picture of a rotator cuff. Okay, so two of the main causes of rotator cuff tears are an acute tear or a degenerative tear. Some examples of an acute tear is maybe falling on an outstretched arm, lifting something kind of heavy. This also happens with like a dislocated shoulder or a broken collarbone. A degenerative tear is something that just happens over time as we get older with age. Examples of that is just repetitive use of stress, a lack of blood supply, and maybe bone spurs. So the types of rotator cuff surgery, there's three types. The open repair is what happens with large and complex tears. An arthroscopic shoulder surgery, an arthroscope is inserted through a small incision connected to a video monitor, which allows the doctor to look at the shoulder and look at where the tear is. A mini open repair is basically damaged tissue and bone spurs are removed or repaired using an arthroscope as well. So if you zoom in on this one for me as well, please. This is an example of an arthroscopic shoulder surgery. You can see all the instruments there trying to fix the shoulder. So to repair a rotator cuff, tendons are reattached to the bone. Small rivets, such as suture or the anchor right there, are used to attach the tendon to the bone. And the stitches or sutures over here are attached to the anchors, which tie the tendon back to the bone. So that's when the surgery is complete. So for the recovery and rehabilitation process, recovery can take anywhere from 4 to 8 months. This is depending on the size of the tear, whether the rotator cuff tear needs surgery or not, and the type of person who tore their rotator cuff. So for example, athletes who are kind of in a sport or kind of muscular, tears their rotator cuff, it's gonna take some time to heal, but it probably won't take as long as a geriatric patient who may be falling at home, is not active, who's kind of not too strong. That type of recovery time will take longer for that type of patient. But for an athlete or a geriatric patient, no matter what, physical therapy is recommended to get that strength and range of motion back as to before they had the torn rotator cuff. So for the post-op exercises, I kind of separated that into 4 different phases. So from 0 to 6 weeks, you're usually having your rotator cuff in an abducted sling, and you're just protecting the repair. From week 6 to 12 is when we start with the stretches and light type of exercises. So some of these are the pendulum, the pulleys, rhythmic stabilization, and the prone row, extension, and T. So when we get to weeks 12 through 18, this is where we kind of start to ramp it up a little bit with some resistance, using the TheraBand for the external and internal rotation, for the seated rows, and the sideline external rotation. So from weeks 18 to 26, this is kind of towards the end when we're almost done with our rehab phase. So we start using some complex type of exercises such as the external rotation, internal rotation at 90 degrees, the standing T's, and some shoulder shrugs with some weight. So now I'm going to be showing you guys some of the exercises that I listed here, with myself demonstrating them for you guys to kind of see visually, see how those exercises are done. questions from the audience?
I got one. Which structure of which part of the rotator cuff usually tears first, or most commonly tears?
So it's usually the supraspinatus tendon. If you'd like to zoom in for me, please. Here's a picture of the supraspinatus tendon being torn. So that's usually the most common one because it usually gets impinged under the acromion. If you want to come take a look at this one as well, please. So whenever you lift your shoulder up there, you kind of get an impingement, which can cause the tear. Any more questions?
I have one. I've heard of the rotator cuff a lot, but can you explain like maybe the names of what make up the rotator cuff?
Okay, so there's 4 muscles. You can think about it as the sits group, okay? So there's the supraspinatus muscle, the infraspinatus, the teres minor, and the subscapularis, which comes out in the front, okay? So those are the 4 main muscle groups of the rotator cuff. Yeah, any other questions?
I don't think so.
All right, well, thank you guys for your time, and hopefully you guys know more about the rotator cuff and the tear.